You've recently been diagnosed with ADHD and you've been prescribed a stimulant. And suddenly one day, you notice that you experience a stinging numbness in your fingers and toes. And this occurs particularly when you step out into the cold or feel stressed. The tips of your fingers turn very white, then move towards a bluish or purplish hue. And finally, they turn very, very red, sometimes with throbbing as the blood flow returns. It's uncomfortable, but you just brush it off. In today's video, we'll be discussing a phenomenon described by a French doctor, Raynaud. We'll focus on Raynaud's phenomenon or Raynaud's disease and its association with stimulants prescribed in the treatment for ADHD. We'll explore the mechanisms, the risks, and the proactive measures to manage this condition. I'm Dr. Sanil Rege, consultant psychiatrist, and welcome to Psychiatry Simplified, the channel where we discuss all things psychiatry, mental health, and neuroscience related. So if that's your thing, don't forget to hit the subscribe button to stay in touch with all our future videos. Today we'll look at a critical yet sometimes overlooked aspect of ADHD treatment, the development of Raynaud's disease or Raynaud's phenomenon. So what is Raynaud's disease? In response to cold temperatures, the body adapts by restricting blood flow to the skin. This is of course done as a thermoregulatory mechanism to prevent further loss of body heat to sustain the core body temperature. In Raynaud's disease, this blood flow restriction particularly occurs in the digital vasculature and in response to cold and emotional stress. This phenomenon was first described by Maurice Raynaud in 1862 and later studied by Sir Thomas Lewis in 1930. Now, specifically in Raynaud's phenomenon, there is a vasoconstriction in the digital arteries and cutaneous arterioles, the baby arteries. So there is a vasospasm of the digital vessels and most commonly affects the fingers and toes. Due to the restriction of the blood flow, this condition is often associated with the stinging numbness as well that occurs. Raynaud's phenomenon can be classified as primary or secondary. Primary Raynaud's is idiopathic, meaning it can occur without any associated illness or any associated medication. On the other hand, secondary Raynaud's is often linked to an underlying medical condition, most commonly autoimmune connective tissue diseases. So it becomes really important if in the treatment of ADHD, if Raynaud's phenomenon occurs, that it becomes important to rule out autoimmune connective tissue diseases. Secondary Raynaud's is most frequently seen in conditions like systemic sclerosis, also known as scleroderma, SLE, and Sjögren's syndrome, along with other mixed connective tissue diseases. It can also occur in patients with rheumatoid arthritis. Now, one of the most important things to remember is that over 95% of patients with systemic sclerosis experience Raynaud's attacks, which indicates a strong association, but also tells us that it becomes crucial to rule out systemic sclerosis. Other potential etiologies include neurological disorders such as multiple sclerosis or carpal tunnel syndrome. There are medications that are associated, such as beta blockers, that can trigger these Raynaud's attacks, or certain chemotherapeutic agents such as cisplatin. Now, for the purposes of the video, I'm of course going to focus on the association between stimulants and Raynaud's disease, but I'd like to preface this by saying that if Raynaud's disease occurs, it becomes really important to involve, of course, the general practitioner and or the physician, including a cardiologist. And it's really important to be proactive here. Why do I say that? I say that because research tells us that Raynaud's phenomenon is not just a peripheral issue. Sure, most of the symptoms may occur in the periphery and are often the presenting complaint. Nonetheless, the big question that we've got to ask is, if the smaller arteries in the extremities are affected, is it plausible that other vital vessels, including those supplying the heart and the brain, might also be compromised? And that's the big question that we need to look at. Now, what do studies tell us? One study showed that Raynaud's can be a strong predictor of systolic left ventricular dysfunction, albeit this was in patients with systemic sclerosis. Another study found that Raynaud's phenomenon was independently associated with increased cardiovascular related mortality among older adults. Furthermore, studies have documented that Raynaud's phenomenon may be a predictor of chronic cerebral ischemia, which highlights the importance of considering this sign as a sign of potential blood circulation impairments that can affect both the periphery, the heart, but also the brain. Furthermore, research has also shown that traditional risk factors such as hypertension, hypercholesterolemia, diabetes, along with Raynaud's phenomenon, are associated with cardiovascular disease in patients with certain autoimmune conditions such as primary Sjögren's syndrome. Now, it's important to recognize that ADHD has a strong comorbidity with a range of medical conditions, including autoimmune conditions. Thus, there may be common confounders that are playing a part here. Now, I've covered the critical analysis of ADHD medications, i.e. the impact of stimulants on heart health in this video here. So don't forget to check that out. To summarize, Raynaud's phenomenon may be linked to both cerebrovascular and cardiovascular health. Now let's look at the pathophysiology and how I would address this in clinical practice, linking to the pathophysiology. Now we know that Raynaud's phenomenon involves exaggerated cold-induced or emotional stress-induced vasoconstriction in the digital vessels. Now this response is mediated by the sympathetic nervous system and particularly through the activation of the alpha-2C receptors. Now we know that these alpha-2 receptors are adrenergic receptors, and the key neurotransmitter that mediates it is noradrenaline. Noradrenaline binds to adrenergic receptors in the vascular smooth muscle cells, leading to vasoconstriction. Alpha-1 and alpha-2 adrenal receptors are primarily responsible for this vasoconstriction, particularly in the smaller blood vessels or arterioles. Now, if you're a clinician who's looking to take your psychiatry education to the next level, don't forget to check out academy.psychscene.com. Linked to what I've just talked about in the advanced psychopharmacology of ADHD and the neuroscience, including our ADHD curriculum, we cover the alpha-1 and the alpha-2 receptors because it's not just relevant for the periphery, but also for the appropriate treatment of ADHD. Why do I say that? Because alpha-1 receptors, for example, are linked to cognitive inflexibility. And thus, we know that stimulants potentiate dopamine and noradrenaline, but the prefrontal cortex operates on a Goldilocks curve, which means that too much of the noradrenergic or dopaminergic stimulation will result in the activation of D1 receptors excessively and alpha-1 receptors. Now, these alpha-1 receptors result in cognitive inflexibility, but as we saw here, also can result in vasoconstriction, thus can sometimes result in hyperperfusion as well. This can result in cognitive worsening. So even though patients may come to you telling you that their cognition is worsened, it becomes very, very important to understand whether this is due to an underdosing or whether this is due to the dose being too high, pushing the individual towards the opposite end of this Goldilocks curve. So this is just one example of the nuances when we're treating ADHD. If you want to take your understanding of ADHD to the next level, don't forget to check out our curriculum here on academy.psychscene.com. So with that in mind, let's jump back to the video. So now we know two key aspects. Firstly, the role of the alpha-2 receptors, and two, that Raynaud's phenomenon should not be taken lightly, as it can be an indicator of cerebrovascular and cardiovascular health. Now, in literature, there are case studies of Raynaud's phenomenon occurring with Adderall, mixed amphetamine salts, but also with methylphenidate. We know that Adderall or dexamphetamine formulations are more potent than methylphenidate. Nonetheless, Raynaud's phenomenon can occur with both of these because both of these have noradrenergic potentiation. In some case studies, discontinuation of Adderall and switching to guanfacine has addressed this. There have been other cases where the Raynaud's phenomenon has persisted despite cessation of methylphenidate. Thus, it becomes important for the clinician to look at not just the medication, but also the other associated factors as secondary Raynaud's phenomenon may be playing a part. Importantly, ruling out connective tissue diseases. So what can be done if a patient with ADHD who's prescribed a stimulant develops Raynaud's phenomenon? Now, conservative strategies such as reducing exposure to cold, wearing gloves or mittens or hand warmers, avoiding additional stimulants such as caffeine or other drinks such as Red Bull or Monster, and emotional regulation or modulation of stress becomes important. Furthermore, smoking cessation, as it's a risk factor, is another important intervention. Now, at the same time, it becomes really crucial to carry out a thorough organic evaluation and seek an opinion from either a cardiologist or a physician or a general practitioner. Now, whilst I go through some of these steps, it's important to recognize that this is general information only. This information should not be used or construed as medical advice. It's important that you discuss any strategies or any interventions with your doctor. So if we look at treating Raynaud's phenomenon in the context of stimulants, of course, some of the strategies include, firstly, as I mentioned, a thorough organic evaluation and other opinions. But then in terms of the medication, one can lower the dose. Second, one should ensure that there is adequate addressing of the emotional arousal. This is one of the missing components in the treatment of ADHD, and I've covered this in 2 other videos, here and here, where I discuss some of the reasons why stimulants stop working, or also where emotional arousal is not addressed. You see, if emotional arousal is not addressed, which means that the amygdala activity continues to be significant, we know that the autonomic nervous system is activated. Excessive sympathetic activity results in vasoconstriction. So we've got this double whammy. We've got stimulants and emotional arousal resulting in excessive alpha-1 activity, both centrally but also peripherally. This manifests as Raynaud's phenomenon in some individuals in the context of stimulant-related side effects. But the key here is to recognize and address emotional arousal. Therefore, address sleep, really important, and emotional regulation. We know that this occurs a lot more in females, and we see Raynaud's phenomenon as well has a greater incidence in females. Here, there is evidence that hormones also play a part, but we won't go into that in a lot more detail now. But we know that females have an emotional arousal model of ADHD, and thus they often require a buffer to address the emotional arousal to allow the stimulants to act effectively and efficaciously. This is an often missed component in the overall management of ADHD. So therefore, what one can consider doing is, along with reduction of the stimulant dose, one can consider augmentation strategies such as alpha-2 presynaptic agonists, which overall reduce the arousal phenomenon. Agents such as guanfacine, which have a lower risk of inducing vasoconstriction, can be used, which means switching to guanfacine, but also clonidine can be a very useful agent. Now, clonidine has a nuance when one is using it, because there are some instances of clonidine inducing Raynaud's phenomenon. This occurs because of its alpha-2 activation. However, there is a dose-dependent release. The key here is to recognize that this clonidine, when prescribed in the context of heightened emotional arousal, reduces arousal and therefore can actually treat Raynaud's phenomenon in the context of ADHD-related side effects. But this is a nuance for the clinician to take into account, and this can be a very effective strategy. So consideration of clonidine versus guanfacine becomes important. However, there is a difference between clonidine, which is an alpha-2A presynaptic agonist, versus guanfacine, which is an alpha-2 postsynaptic agonist. Hence why one really has to take into account the nuances when using it. I've covered this in the video here, the differences between clonidine and guanfacine. The studies have shown that reduction of alpha-2 activity can address these vasospasms effectively. And finally, from a longer-term perspective, regularly monitoring vascular health, we know blood pressure, pulse, but also asking about these specific symptoms of vasospasm in the context of cold or emotional stress may help us manage the condition over the long term. Thus, to summarize, Raynaud's phenomenon is a phenomenon that of course can occur outside the realm of psychiatry. But in the context of ADHD management, stimulants can precipitate Raynaud's attacks. And when this occurs, Raynaud's phenomenon should not be dismissed as just a peripheral issue, as it can have significant implications for overall cardiovascular and cerebrovascular health. For patients who have experienced this phenomenon, it becomes important to be proactive in addressing this. And this can be done through liaison with cardiovascular specialists or general practitioners, along with a psychiatrist, and there are a range of options that could be considered. An important thing to take into account is, of course, ruling out other medical causes, as there are strong associations of certain medical conditions such as connective tissue diseases with this phenomenon. What ADHD medications may be doing is simply precipitating or unmasking some of these phenomena. So I hope that you found this video useful. If you like this video, don't forget to leave us a like, and of course subscribe to our channel to keep in touch with all our future videos. Please don't forget to leave comments in our comment section, as this particular theme also was prompted by someone talking about Raynaud's phenomenon and actually talking about the benefits that they obtained with guanfacine. A big thank you to all of you for supporting this channel. We really appreciate it. I look forward to seeing you in another video soon. Until then, stay curious. Bye-bye.